Hi, today is our newly adopted guinea pig's first vet check. Um, she was originally scheduled today to have her staples removed from the vet, but the night before she had a lot of really bad symptoms. She was clearly in a lot of pain. She wasn't acting like herself at all. She was dry heaving, it looked like. She was just rolling on her side and twitching in pain, and she wasn't eating. She wasn't really drinking. She drank a little bit if I brought the water to her, but she was just clearly in a lot of pain. So we took her to the vet early and dropped her off there for observation. They weren't sure if she was having a seizure, if it was something going on, but we just got her back home. She got her staples removed, and it turns out that what she was experiencing was side effects from infection of her surgery, the staples around the surgical wound. So they did a bunch of stuff to her. They gave her some critical care because she hadn't eaten anything. They gave her some fluids because she was a little bit dehydrated. And they also gave her some antibiotics, anti-inflammatories, and they cleaned out her wound to get a lot of the infection out. It was inside of the skin. Nothing was showing on the outside, so I couldn't really see anything, but it was really bad. And I got sent home with a list. She's got to take, she's got to take a antibiotic, an anti-inflammatory, and prokinetic, and she also is underweight, which I knew. She wasn't really taken care of very well, and she's low in vitamin C, which I've been working on, but we've got her some more options to help her get a higher dose of vitamin C. And she has another appointment in a week, so we're gonna see how this works for her. And she's here. She's good. She's feeling, I think, a little bit better. She's definitely better than last night, but she's still not quite herself. I'm gonna go ahead and do the evening treatments for her and see how she likes it. So this is her setup currently. I've go ahead and cut her cage in half so that it is less incentive for her to move around. I want her to be a little less active if she does feel up to it. That's her in there. Oh, and we named her Kara, by the way. Kara is named after the Supergirl. So she's named after Supergirl. Yay! Because she is a fighter. Yes, she is. But she's doing okay. She's still definitely not herself, but she's definitely better than last night. And we're gonna have to clean her cage constantly. And we're also I'm gonna be doing cage cleanings every day. Basically gonna be moving her from one side of the cage to the other so that she has a clean area to be on every day. So it's gonna be a lot of laundry, but it's worth it. So alright, baby. Do you wanna try some of your evening medicines? As you can see, she's out and about. She's eating some hay, which is good. Got some vitamin C tablets down there and a little pea flake if she's up for it. She seems to be in good health. I just gave her some mite medicine she was not happy about. I used this brand and I just gave it to her, so I'm trying to keep her distracted so that she doesn't really notice it and start grooming herself. It's actually really tricky to try and find the skin on long-haired guinea pigs. Oh, hi, honey. Hi there. You wanting more treats? You've got some treats in your cage. Are you just happy? You can see a little wet spot on the back of her neck. Hi, baby. See that? Oh, so much. Well, drinking some water. That's always good. Drinking so crazy. Oh my goodness. I moved it closer to her bed so that she wouldn't have to move as much. You're such a goof. Oh, you're such a goof. She's just doing everything right now. I just gave her medicine, so I think it's just bringing her back. You're doing so good. She's probably shaking because of the little mite formula on her back. They found some what looked like dandruff on her skin in some areas, so we're just doing a preventative measure for mites. I don't think I'm going to treat my other guinea pigs because they haven't had any contact with her, but I'm going to definitely keep a close eye to see if they show any signs. But I try not to use the mite prevention unless I really need to, because I don't want them to develop a tolerance or anything for them. I mean, my other pair of guinea pigs is on the opposite side of the house. They haven't even met or have been around each other or anything. The only thing they have in common is me feeding them, but I do wash my hands before and after being with them, just so that I don't carry any of their scent or anything like that. Is that good? So happy she's eating. I actually have some critical care, just in case. It's the critical care apple and banana. She already had some today. So I'm so happy you're eating. Yay! The vet is saying probably around a week or two she should be the majority of the way healed. She does currently have, whenever they removed her staples, they said that they were just terrible. There's way too many, and some of them are like curled into her skin. It took them in half an hour to get the staples out, which is like crazy. And the infection, I'm honestly not surprised. I mean, if you watched my last video, you saw the state that I received her in, and that was picking her up from the vet. So right after surgery, I think she was with him for 4 days after, like post-op, before I was able to adopt her. They wanted to keep her there. So for 4 days, she sat there in that small little pet store cage, basically just sitting in her own waste. So I'm definitely not shocked that she had an infection at the surgical site. It's just extra disappointing because everything that she's going through now, all this pain and all this stress of having treatments and medicine. I mean, she has to take 4 syringes a day. No, 5 syringes a day of medicine now for at least the next week. And that's just, it's so sad. Luckily she's good. She's good about it. But it's just, it all could have been avoided if the vet, a trained medical professional who specializes in exotic pets, if he would have just had the proper environment for her post-op, I mean, you would think that would be obligated. And as far as her daily routine, she's got to have 3 syringes in the morning of medicine, and she's got to get some hydrotherapy once a day or once every other day. I'm probably going to do it daily, where I basically have to put her in the kitchen sink and get some warm, like room temperature water going through like the sprayer head on the kitchen faucet, and I'm going to just run that over her belly, over the surgical site, and just keep that on there for 5 to 10 minutes. Which I'm not sure if she'll be a fan of. They did it to her at the vet, and they said she was a trooper about it, but I don't know if she's gonna like that. We'll have to see. And then after that, she's got 2 more syringes in the evening. But she's doing so much better. I'm so glad. But that's pretty much all the updates I have now. And I'll keep you updated if anything else happens. But hopefully it's just going to be a nice and steady progression of her healing.